What's up guys, I'm Jace of HerniaRecoverySurgery.com and Defy Fitness, and I'm off work a little early today because I'm actually going to head to a world-renowned hospital, Shouldice Hospital, which specializes in hernias. Actually, I'm going to tell you more about it on the ride there. Let's go. So I'm here at the entranceway of Shouldice, and I must say I'm always so impressed by the lush grounds and beautiful landscaping. To me, it just gives me more of a sense of tranquility and peace being here rather than at a general hospital that just feels kind of, more cold. The parking is easy, it's clear with signs telling you where to go, and you'll find parking kiosks like these. You simply just pay at these kiosks with your credit card and you're good. So this video series will provide you with the Shouldice Experience, from the consultation, booking the surgery, checking in for surgery, surgery day, and then significant landmark days recovering afterwards. So hit the like button and subscribe. Hit the bell to be notified when I release the next video. Here we are. Welcome to Shouldice.
Okay, I'm in the hospital lobby, and let's head to the left to the exam clinic reception. Oh, here's Greg, front office supervisor at Shouldice. He's welcoming me to the hospital and having me check in before my examination. I have to fill out some forms, which I'll fill out in their lovely sun-filled waiting room. The forms are asking for some basic information, name, address, emergency contact, followed by health history and information pertaining to my hernia. Time for the PSW to get some data. She's first taking my waist circumference, my weight, my height, and blood pressure. I'm now meeting with Dr. Simmons, one of the surgeons here at Shouldice. Dr. Simmons is just asking me some basic questions about my hernia, how it happened, how often it protrudes, the amount of pain I'm in, etc. He then uses his stethoscope and has me take a few deep breaths. He does a check to see if I have any weakness in my abdominal areas, which fortunately everything looks good and seems solid. He asked me to drop my pants to do a check of my testicles, followed by checking my good side. I turn my head to the side, hold my breath, and then push my belly out like I'm straining on the toilet. He then does a comparative check on my bad side, my right side. So my hernia wasn't showing up as obvious as the doctor would like. So he had me lie down and did another check holding my breath and pushing my belly out again. Unfortunately, again, the hernia does not show up. So Dr. Simmons does another test to try to reproduce my hernia to protrude. He asks that I do squats, pressing down against the floor as if I have a really heavy load on my back. Now, again, unfortunately with this test, we still can't replicate my hernia to protrude. Luckily, I did take a picture of my hernia protruding and shared my recent experiences of the activities that aggravated my hernia. Let me summarize some key points with my discussion with Dr. Simmons. My hernia repair is actually low risk, and repair is not necessary. It's only dangerous when the intestines bulge out and they're trapped and cut off its own blood supply. Now, this risk is less than 1% per year and less than 2% in my lifetime. And because of this, I can still continue exercise and daily activities. So Dr. Simmons tells me some key differences between hernia surgery at a general hospital versus Shouldice. At a general hospital, surgeons perform 25 to 50 hernia surgeries per year. For most of them, the most reliable results are usually using a mesh. You go in for day surgery. You are given a general anesthetic. 10 to 15% of people that get mesh can get chronic pain that lasts longer than 3 to 6 months. The risk of infection is slightly higher. Now at Shouldice, the surgeons do about 600 to 700 hernia surgeries per year. The surgery is more complicated in order to avoid using a mesh. It's inpatient surgery, so one night in the hospital before the surgery, and then you stay 2 to 3 nights after. Patients are given conscious sedation as opposed to a general anesthetic, as it's easier on the body and safer. After this, the patient is given a local anesthetic and a 3 to 4 inch incision is made. Everything is put back in place, and they bring together the stronger tissue to hold everything in place and then permanently suture together. The risk of the hernia coming back is less than 2% for the rest of your life. and it may take about 2 to 4 weeks before going back to normal activities. Now, my hernia is about the size of an egg, which is considered to be a medium-sized hernia, and will continue to only get bigger and more uncomfortable. Especially if it prevents me from normal activities, I can use a hernia belt. This will help keep my hernia reduced. They do request that the hernia belt is not used 2 weeks before the surgery to keep the surrounding skin around the hernia healthy. I will provide a couple of links in the description below for the hernia belts.
So that concludes my consultation. I've told them I've actually decided to go ahead with the surgery, and I'm just going to be waiting on a confirmation email from the booking department within the next couple of business days. I'm Jace, and I'll see you in the next one.